Today's topic, we can discuss about MCQs regarding the brachial plexus. So to know more about the brachial plexus, I'll give the link in the description box. Just after watching it, just come and practice all these questions. So first question is the brachial plexus is formed by the ventral rami of which spinal nerves? Spinal nerves. So the question is from which of the roots the spinal plexus are arising. So as I said, it is formed by the C5, C6, C7, C8, T1. So the option is C. Coming to the second question, which part of the brachial plexus is located between the anterior and middle scalene muscles? So normally the roots arises from the spinal ventral rami, whereas trunks is the one which is presented between the anterior and middle scalenus muscles. Then coming to the third question, the dorsal scapular nerve arises from which spinal root? So the dorsal spinal nerve is a branch from the root, is one of the branch from the root of the brachial plexus which arises from the C5. Coming to the fourth question. Question is the suprascapular nerve supplies which of the following muscles? Option A, supraspinatus and subscapularis. So supraspinatus muscle is supplied by suprascapular nerve, whereas subscapularis is supplied by subscapular nerve. Coming to infraspinatus and supraspinatus, yes, both the nerves are supplied by the suprascapular nerve. So the option is B. Whereas teres minor is supplied by axillary nerve. Okay, coming to the fifth question. The musculocutaneous nerve provides motor supply to all except. So, musculocutaneous nerve is the nerve of anterior compartment of the arm. So, the muscles in the anterior compartment are biceps brachii, coracobrachialis and brachialis. Whereas triceps brachii is the muscle of the posterior compartment. So, the musculocutaneous nerve supplies all these three, and it does not supply the triceps brachii, which is supplied by the radial nerve. So, option D. Injury to the upper trunk of the brachial plexus results in which condition? As we know, the C5, C6, the upper trunk lesion is the Erb's palsy. Coming to the seventh question. A patient presents with claw hand due to lower brachial plux injury. Which nerve is primarily affected? Claw hand is mainly occurs in the lower brachial plexus in the sense C8 and T1 is affected. So T1 is affected. It is the Klumpke's paralysis. So they are asking about the nerve which is involved in this injury. So the nerve which arises from T8 and T1 is the ulnar nerve. To the eighth question, the long thoracic nerve injury leads to. So long thoracic which arises from C5 and to C7, it's a long thoracic nerve. So when the muscle which is supplied by the long thoracic nerve is the serratus anterior. When this muscle is it does not get any nerve supply, the winging of scapula will be taking place. So the option B is the correct answer. The posterior cord of the brachial plexus give rise to which of the following nerves? So the branches of the posterior cord, as we see, musculocutaneous nerve and ulnar nerve. Musculocutaneous nerve is the branch from the lateral cord, whereas ulnar from the medial cord. Axillary and radial is the branch from the posterior cord. So whereas answer is the axillary and radial. Which nerve does not arise from the medial cord of the brachial plexus? So ulnar nerve, which comes from the medial nerve. medial cord. Medial pectoral is also from the medial cord, whereas radial is from the posterior cord. So the answer is C. So these are the questions mainly regarding the brachial plexus. Thank you.